to call this coronary vessels.
Nice to have them. Yeah.
In case you're wondering, I'm going to the end of class today at 12:45. The coronary vessels, it starts with left coronary artery. How about I color it in red? It branches right off the ascending aorta. It stops right there. It's very short. It stops and it immediately bifurcates into the left anterior descending and circumflex artery. So the branches of it are anterior interventricular artery, also called left anterior descending, also called, well, the widowmaker, because a lot of times men are more prone to atherosclerosis, and this clogs and causes a massive heart attack. Widowmaker. But anyways, anterior interventricular artery is usually what the anatomy books will call it. Now, so it's a branch of left coronary artery. How about I color it in green here? It's going to descend all the way down from this point on. I'm coloring in left anterior descending. He gives a lot of branches along the way, but just know the main one. Left anterior descending. Notice the other branch wraps around the back. That's called circumflex artery. So these are all branches, like branches of a tree. So if they ever call any of these circumflex branch, don't be put off by it. It's just another way of saying it's an artery. Artery's branch. So how about I color that purple? So the circumflex branch. It's right here. So that's the left coronary artery in its two branches. The right coronary artery is much longer. I'll use red again. Going all the way to the back there. I'll just color it in on the front here. Now look how long the left one is versus the right. The right is longer than the left. It gives off a lot of branches along the way. There's a couple you need to know. One is the right marginal artery, branching off right coronary artery. How about I use orange? So this is the right margin of the heart, and there's an artery that runs along that margin, and it branches off the right coronary artery. So I'll just color it in orange there. This is the right marginal branch. The right marginal branch, the right marginal artery. Notice how the right coronary artery, it goes around the backside. So they kind of like color it in, like kind of like that. This is a continuation of right coronary artery going around to the backside of the heart. And there's a branch coming off here. It's called the posterior interventricular artery. I'll use a different color. How about this light green? Posterior interventricular artery. So I'll color it in this lighter green color. And that's what you're responsible for. The two coronary arteries, the right and the left, and their two branches respectively. Okay. Now, the veins, I have a few that I want you to know. And I put that on the next slide, but you have the colored plate. This shows the veins. And let me erase the arterial supply. So this is showing the veins that run with the arteries. So if it's blue, obviously going for the cardiac vein. I want you to know this one here, the great cardiac vein. Right there, great cardiac vein. Let me color it in blue. Great cardiac vein. Called coronary vessels, cardiac veins, and this one runs with the widowmaker, anterior interventricular, runs with this guy. Okay, so I'm going to color it in here. It's in the anterior interventricular sulcus. Middle cardiac vein runs with this one down here. Middle cardiac vein runs with posterior interventricular artery. I should probably use a different color. How about purple? So it's middle cardiac vein. I'll color it in purple. It's a continuation right here. Kind of meet front to back there at the apex. This is the posterior part of the heart viewed from the front. That's why they're kind of dotted lines here. That's where the middle cardiac vein would be. It runs with posterior interventricular artery. The small cardiac vein runs with right marginal. Small cardiac vein runs with right marginal. I use this pinkish color to color the small cardiac vein. On the right margin of the heart, it's right here. We'll make double sure what that is. Right there, small cardiac vein runs with the right marginal artery. So these arteries and veins, they run together. And the models are easy. Blue is vein and red is artery. Make it really easy for you guys. The most important one is the coronary sinus because it takes all of that blood and drains it to the RA. And so I would color right here. So let me go coronary sinus. I'll use blue for coronary sinus. And on our coloring, I would usually label it right here at the end of it. So I'm writing coronary sinus. Okay. Here's the back side of the heart, posterior interventricular sulcus. So here is the middle cardiac vein, right there. There's the posterior interventricular artery, they call it branch. Coronary sinus right there, inferior vena cava right there. So that's a back view of the heart. But the coloring plate really didn't show you a back view, so I wouldn't do that. But some of these slides I noticed are repeats. So what I thought it would be a good idea is to start the cardiac cycle. And so I'll come back to these slides. If you're one that follows along on the slides, I'm going to leave this batch of slides and go to the batch of slides that is called the cardiac cycle. It's a good thing to do in summer since you just went over the anatomy. Start to cover some of the physiology, although not all of it, because it's too much to cover in one day. But this is what you get when you sign up for summer. Also, I'm not trying to punish you, but also, you know how I didn't teach Monday or Tuesday? I was getting real antsy, just sitting up here watching you guys study. I gotta teach. So it's all coming out now. So I gotta start the next unit. So we call the cardiac cycle all the mechanical events that occur during a heartbeat. Because really, it's electricity that causes it to occur, as we'll learn when we talk about ECG next week. All the mechanical events of one heartbeat. If you ever listen to a person's beating heart with a stethoscope, it makes that lub-dub sound. L-U-B, D-U-P. Two heart sounds, lub-dub. Turns out that's the sounds of heart valves closing. The heart sounds are the sounds of heart valves closing. The AV valves and the SL valves, the ones at top, just tri-inches. And it turns out the length of time for one heartbeat is about 0.8 seconds. One cardiac cycle, 0.8 seconds. Okay. Turns out, per minute, that rate would be 75 BPM. And that's kind of the textbook average. Not to be gender biased, but they usually base the kinesiology things off of a male, 5'10", 175 pounds. That's kind of like the standard that books base numbers off of. And for this heart rate, we kind of study one that's about 0.8 seconds for one cardiac cycle. Now, I already mentioned this. Diastole, systole, filling phase, emptying phase. Okay. If the heart's going to pump blood, it must first fill with blood while it's relaxed, right? So the thing to pay attention to when you study the cardiac cycle is pay attention to the valves. You got four. You got two AV, two SL. Are they opened or closed? The two AV valves will open together Are they open or closed? Because the entire cardiac cycle can be understood by noting if the valves are open or closed. Another thing to keep in mind is our what are called pressure gradients, because the heart generates pressure to push blood from one place to the other. Pressure. Let's just eliminate the word gradient, because that kind of scares students. Just pressure. Blood flows from an area of high pressure to low pressure all the time. Blood flows from high to low. Makes sense, right? That's easy to get. Keep track of that because we got to keep track of pressure in the atria, the ventricle, and the aorta. Also, the third thing is this whole systole, diastole thing. Because it turns out the atria have a period of systole and diastole. But the ventricles, they also have their period of systole and diastole. And those terms, whenever we use the term systole, diastole, we usually refer to ventricles. Because they are the important dudes. Atria, you could live with AFib. You could walk around and talk to people. It's not lethal. Right? You definitely want to get that treated. VFib, you're lying on the ground, you're going to be dead in minutes, right? If someone doesn't get the defibrillator, right? Because the ventricles are the blood pumpers, right? If you go into VFib, your blood pressure is dropping like a rock, and shock will ensue in seconds to minutes. All right, so, and when we talk cardiac cycle, we have right heart, left heart. We usually just only discuss left heart. LV, LA, aorta. So those are the key things. Valves, what's going on there, pressure, and the whole systole diastole thing. So you got to put it all together. Turns out, of that 0.8, diastole is about 0.5 of that 0.8, and systole is about 0.3. They're both important. Systole is the thing. It's what the heart does. That 0.3 seconds, you're ejecting blood from the heart and pushing it to the body parts. A strong heart contracts hard. Now, here's the whole thing about the valves. If you chop the top off and this is a superior view. This is kind of like posterior, that's anterior. So you're looking at the two SL valves, the one in front, pulmonary semilunar valve. Notice how when the heart fills with blood, we call that inflow. So the AV valves are open, the SL valves are closed. Ventricles fill with blood. If you skip to the outflow phase, the AV valves close, the SL valves open. Okay. So this way, the blood doesn't regurgitate backwards into the atria. Notice there's a brief moment where all the valves are closed. So they call it isovolumetric because blood isn't coming in or blood isn't going out of the ventricles. So whatever volume of blood is in there, it's going to remain. Okay. So that's kind of a useful picture to look at to get the idea of inflow, outflow. The relative thing is the ventricles. Blood flow into the ventricles, blood flow out of the ventricles. That's why I had you note, are the valves open or closed? Let's identify the four valves. Tricuspid, bicuspid, pulmonary semilunar valve. What's left? Aortic semilunar valve. One more time. Tricuspid, bicuspid, pulmonary semilunar valve, boom, aortic semilunar valve, okay. Now, you have this coloring plate, but I decided it's easier for me just to draw it on the board to kind of take students through the cardiac cycle. And so what my strategy is to show you like the data graph that you're supposed to know, as well as the pictures that help you understand the data graph I want to draw out, which is Again, this figure in your book, you have it, you can color it later if you want. And because it's a cardiac cycle, you could start anywhere in the cycle through that love dub, through the diastole or systole, and get back to where you started from. Now, because it's systole, diastole, you think it might be 2 parts. We usually divide it into 4 or 5 parts. Okay. For the systole and diastole. Let's call this first part ventricular filling. That's what's being shown here. Diastole, ventricular filling. And the data graph that you got to know, I'm going to draw it here. I'll try to color code. We're just going to pay attention to the left ventricular, the left heart. So we're going to pay attention to pressure. Now, pressure in medicine, they usually use units of millimeters of mercury. In physics class, it's usually pascals. But millimeters of mercury is the pressure that will displace a column of fluid. In this case, millimeters of mercury. So let me give you some numbers. How about like 0, 10, 80, 120? All in millimeters of mercury. But let's keep track of the blood volume of, say, the left ventricle, since we're paying attention to the left heart. And let's go 120 mLs. Let's go down to 50 mLs. Trying to stick with the textbook numbers. And this is over time. How long is one love dub? 0.8. So let's pretend it's going to be the 0.8 seconds. 1 heartbeat, 1 love dub, 75 beats per minute. And all the things that happen in it. So this picture here, do you see how I put 3 pictures? This is all ventricular filling, and it's early, mid, late diastole. Early to mid to late diastole. The heart's relaxed, and it's filling with blood. Now, I don't know why, but most books, when they present this in a textbook, they usually start with mid to late diastole. So we'll start there. We'll start right here. And so when we finish this, we'll get to early diastole. And know what you're looking at when you study these pictures. We're just going to talk about the left heart, but they show the right heart too, which is good. If they show black arrows, that means systole for those chambers. The arrows that are internal show the direction of blood flow. Here you've got an empty gas tank, you're filling up the ventricles. Okay, so mid is right here. So what's happening is, if pressure is going to flow, if blood is going to flow into the ventricles, the pressure must be lower there. That means the pressure in the LA, the left atrium, let's say this is my line for LA, 10 millimeters of mercury, left atrium. It's right around there. If blood is going to flow into the left ventricles, the left ventricle pressure, I'll use the orange line. Let's say that's LV pressure, it's lower. So that way it can receive blood. Okay, that's my first point. LV pressure is less than LA pressure. And usually when it fills, you're like filling right around here, and you just start to fill, you're just filling the heart with blood. When you get to late diastole, in the ventricles, what you see to finish filling the ventricles, like topping off the gas tank, you have atrial systole at late diastole. Atrial systole occurs. And that's shown on the frame on the right. This is late diastole, atrial systole. You're pushing the rest of the blood into the ventricles, like that pectinate muscle is just squeezing and pushing, finishing off the filling. Usually it's like the last 30% of ventricular filling, something like that. So with that sudden squeeze, it makes the left atrium have like a little blip, which makes the left ventricle have a little blip in the pressure curve, just finishing off the filling. And so for our volume curve, we fill up the gas tank all the way, makes a little blip there. So that's great. We filled this ventricle, now it can pump it. But let's take note of how much you filled it to. The more the better. Usually textbooks will say this is around 120 ml. So at the end of diastole, the volume of blood is called the end diastolic volume. EDV for short. 120 ml. That's the amount of blood available to pump. But we haven't pumped yet. We're just at the end of diastole. We haven't started systole yet. Okay, anyways, I kind of color-coded it. I used orange here. So, I don't know, maybe orange. It's all orange. Okay, do you have any questions before I move on to systole? This is diastole, so the heart's relax. Okay. All right, so now I have these pictures. We're going to begin systole, but systole has two parts. There's a part where you just begin to squeeze the heart. The cardiac muscle is starting to squeeze, but you got to squeeze a lot. So for the first part, you're not really pumping any blood. They call this isovolumetric ventricular contraction. So let me erase these notes here so you don't confuse them. It's the next part. We're done filling. Isovolumetric ventricular contraction. Consider it the first part of systole. The heart is starting to generate pressure. So how about I use green? Basically, my LV, I changed the marker from orange to green on mine. You don't have to use the same color I do. Pressure will start to rise. I'm going to stop right there because left atrial pressure will stay low. And so it's relatively unimportant. So I'm just going to extend the left atria pressure. It just stays low. But man, LV pressure shoots up. Okay? And so as soon as the pressure exceeds the LA, okay, right at this point right there, I'll put a little star there. I'm pointing right to there. This is when you get the first heart sound. The bicuspid valve closes. Let me put the star here. Pressure starts to rise when the LV pressure exceeds LA pressure. Bicuspid valve closes, and that makes the lub sound. Because you don't want blood to regurgitate backwards into the atria. And the picture shows it, if the graph doesn't make much sense to you. You see black arrows squeezing both ventricles. I'm just talking about the left one. And blood wants to flow backwards into the atria, but it doesn't. Those valves close, and you hear the lub sound in the stethoscope. They're closed. Okay, and they're resisting that pressure because they have the chordae tendineae and the papillary muscle keeping them closed so you don't get the regurgitation of backwards blood flow. So pressure is rising. Keeps going, keeps, well, how high do you have to go? It depends on the arterial pressure. So let me draw a third line here. I'll use black. This line that's descending is aortic pressure, aorta. And it's dropping from the previous cardiac cycle because blood is flowing away and you haven't pumped any blood into it for this time. However, the heart is now rising to meet arterial pressure. So I'm going to draw the green line all the way up to here and stop. So for isovolumetric ventricular contraction, basically you're getting a huge jump in pressure. Pressure in LV rises to meet aortic pressure. On the slide, I say about 10 to 80, right? You go from 10 to 80, that's why I say there. 10 to 80. And note that this is an isovolumetric phase. As soon as that bicuspid valve closed, you know, the SL valves, they're already closed. All the valves are closed. So blood doesn't come in or out. It's isovolumetric. No volume change during this phase. All the valves are closed. So I'm going to draw a green line that corresponds with the green pressure rise of this phase. And I'm going to keep it at 120. It stays the same. Why? It doesn't change. It's the EDV. Okay? So it's just isovolumetric. Now the next part is the most important part. Is there any questions on this part? Here's a picture of the bicuspid valve closing to prevent regurgitation of blood during isovolumetric or any kind of systole. These heartstrings become taut, they're holding the cusps closed. When the heart wants to fill with blood, this has to be open. So open, closed for the bicuspid valve. Nice slide of that. And when you get your sheep heart, be able to distinguish cusp, chordae tendineae, papillary. Those are the AV valves. Here's the what we call the outflow phase. Second part of systole. Outflow. I also call it ventricular ejection. You're ejecting blood from the heart. Second part, systole. Okay. So this is the big moment. The heart is doing its job. So here's how I'm going to draw. I'm going to use red for this phase. For outflow. And what happens is you're going to get your pressure peak here. So the green line continues as a red line for me, and you're going to max out at 120 about and start to drop off for the left ventricular pressure. You're going to exceed the aortic pressure, which will look like this, black line. There to there. That's kind of how you want to draw it. The red line is LV pressure. The black line is the aortic pressure. So again, which pressure is greater? LV pressure, so you're going to push blood into the aorta during this phase. And so I'll use red for outflow for my volume graph. You have a full tank of gas, okay, now you're going to like pump all the blood out. You push most of the blood out first, and then it kind of tails off like that for systole. So let me describe it as LV pressure exceeds aortic pressure at the moment you exceed the aortic pressure, the aortic SL valve opens. I want to point exactly where that occurs. Put another star there. Right there. Right there. The aortic SL valve opens right at that point. Okay. Now you're ejecting blood from the heart. You had 120 mils to eject, but you did not eject every drop of blood. You eject mostly, most textbooks say you'll push out down to 50. Okay? So the volume of blood left in the heart at the end of systole is called the end systolic volume. ESV for short. Most textbooks say something like 50 ml will be left over in the heart. The less, the better. Okay? I mean, if ESV starts to increase, it's like, oh, what's going on? You're supposed to pump me out. Maybe you have some heart failure. Maybe you've had a heart attack. You know, so you want cardiac performance to be well. You want to keep it kind of low. But usually this is the textbook average. So how much did you push out? I mean, you have 50 left, you have 120 to start. How much did you push out? 70. So we call that the stroke volume. The amount of blood ejected from LV, about 70 ml. In this case, I mean, obviously the numbers vary. The more the better, okay? If you can push out more with each heartbeat, your heart rate can like decrease. Your resting heart rate can be less because you're good at pushing it out. Okay, this is the most important part because it's the job of the heart to push the blood to the arteries. It's the heart pumping. The heart pumping part is this part. Anyways, now the heart muscle is starting to relax during this phase. You can see you peaked out at 120, but you're starting to drop off. The heart muscle is starting to relax right there. And so this enters us into isovolumetric ventricular relaxation. Did someone just leave? I have a very important announcement. So the person who left, be sure to tell them. I want to tell you the very important announcement at the end of this. Okay. Yeah, usually I don't care if you leave, but if I have important announcements, I want someone to tell them. Can someone tell them?
Would you leave?
Okay.
I
I saw someone left. Anyways, I don't like people that miss announcements, so I just want to make sure that person gets word. Well, anyways, now we're in a state of relaxation, so pressure is going to drop. So I'm going to use the blue line to illustrate that. And it's going to drop. So the red line continues as the blue line keeps drop. Basically dropping. Okay, now here's the thing with the aorta. It's going to make a little notch right here. And they call that the dichrotic notch. So what's happening there is, so we had the SL valve open, and blood was flowing through it. They call that positive flow. We call it outflow. The thing is, as soon as pressure dropped, where I changed from red to blue, the valve closed because pressure was decreasing inside the ventricle. So there's how it looks closed. And when it closes, right here, blue star, the aortic SL valve closes. What happens is blood actually starts to flow backwards. They call that negative flow. But when the valve closes, it makes a dup sound. And what happens is you restore the positive flow like this. Blood starts to collect in the little sinuses, and it has a quick reversal, kind of like that. And that quick reversal restores the positive flow, but it also creates that dichrotic notch. Because, you know, that blood's a little, it makes the vessel kind of twitch a little bit, and you get that quick reversal, that little turbulence. And it creates the dichrotic notch. Anyways, keep track of these stars, because that's like valves opening and closing. The bicuspid valve closed there. The aortic valve opened there, and the aortic valve closed there, making the dup sound. And as pressure drops, the whole point of the pressure dropping is you want to refill for the next one. Okay? Now, during this time, the volume is not changing. So I'm going to extend it to here. So what's my volume at this time? It's still 50. Blood is not leaving or entering this chamber. No blood enters or leaves. So, as soon as pressure drops below, pressure of the ventricle drops below that of the atria, I'll use orange again, right there. At that point, right there, I'll use orange. That's when the bicuspid valve opens again, and you can feel for the next cardiac cycle. So I'm going to draw yellow, this is orange, sorry. You're filling again. And I'm going to fill exactly to where I left off. Got it? Filling, this is, well, what we called this prior was early diastole, the beginning of ventricular filling, when the bicuspid valve opens again. You write that on the board. during diastole. Start ventricular filling. You're at 50, you want to back refill, and eventually you want to get to 120 again and start the whole thing over. Okay? So again, the orange star, bicuspid valve opens. And that's the entire cardiac cycle. Take a look at the rest of these slides. We'll start to wind it up here.